As with any lifestyle change or physical exercise program, consult your physician before you begin your yoga practice. If you are pregnant, discuss your yoga practice with your yoga instructor. As your pregnancy progresses, you will need to modify or avoid certain poses. Move at your own pace and modify the poses as needed in order to maintain alignment and easy breathing in every pose. If you feel any discomfort, dizziness, or pain during your practice, either modify the pose so that you are comfortable or take a few moments to rest. It is very important that you listen to your body and practice yoga in the manner that is the safest and most comfortable for you. Namaste.
The next pranayama we're going to work on is called the cleansing breath. Now, the cleansing breath should actually be done as your last breath, your last breathing exercise. If you're doing pranayama with your physical yoga practice, the cleansing breath would be practiced just before you go down into savasana at the end of your yoga practice. One of the wonderful things about the cleansing breath, for those of you who have smoked or taken in substances in the lungs, even just pollutants that are in the air, which is all of us, the cleansing breath gets the stuff that buries itself down at the bottom of the lungs out. And that includes carbon dioxide. The cleansing breath should be done in a standing position. Allow your feet to be hip-width apart and allow the arms to hang loosely to the sides of the body. Make sure your hips are directly over your heels. In other words, you're not standing too far to the front so your toes are gripping into the earth, or you're not standing with your weight too far back onto your heels so that your upper body tends to slouch. The body is properly lengthened. Again, just like in your seated positions, the spine lengthened straight up. Take a deep breath in. Then, with almost coughing motions, you're going to purse your lips and allow the air to come out of the body. Now, as you're doing this, don't allow the cheeks to puff out. So it's not as if you're blowing out a candle. You're simply placing the lips in a position as if you're about to whistle, which I can't do. So place the lips in position. As you continue this, you'll feel the chest, the back, the abdomen, the lower back, everything squeezing inwards to emit the air. Think of the body like a sponge, where the air fills, like the water fills the sponge. The sponge expands, the body expands. And with the cleansing breath, you're essentially squeezing the sponge, essentially squeezing the body into its core, emptying the air. Inhale. After you've finished the cleansing breath, move back into full yogic breathing or normal breathing for 10 to 12 breaths. If you're a little bit lightheaded, you can stay longer with just your full yogic breath before you move back into a cleansing breath. You may notice some shaking in the body as you close up, and that shaking is simply the muscles of the body contracting to squeeze the last little bits of air out from the body, getting whatever's left in the lungs out.